Today's episode is brought to you by the Whole Life Decluttering Workshop, featuring a proprietary 6-step system, the Simple System, to help you declutter your life in a way that will last. Purchase this workshop on demand and receive the video training and dedicated workbook at positivelyproductive.com/resources.
People's values change over time. People's expectations for themselves change over time. People's expectations out of medicine, people's fears as they experience more things may change. Someone who may have been really gung-ho about something, as time goes on and they experience more illness or have more interactions with healthcare, and they may actually pull back. And you would say wait a minute, but you used to say this. That's okay. There's no right answer, wrong answer. There's your answer.
You're listening to the Positively Living Podcast. I'm your host, Lisa Zawrotny, founder of Positively Productive Systems and a productivity coach certified in positive psychology and stress management. Join me as we explore ways to live a more proactive, positive life with episodes on productivity, self-awareness, mindset, entrepreneur life, habits and systems, simplicity, fun, and more. I understand overwhelm personally as a multi-passionate entrepreneur, wife and mom to kids and cats, and as a caregiver. I'm here to help you choose what's right for you so you can do less, live more, and breathe easier. Sound good? Let's get to it. Welcome to the Positively Living Podcast. I'm your host, Lisa, and today's topic is a personal one for me. As a repeat caregiver for elderly parents and as a mom of 2, I've experienced the challenge of caring for myself and others, which is difficult enough in general, but especially when it comes to medical visits. Whether you're navigating a regular appointment, researching long-term care, or dealing with an emergency hospital visit, there is so much to juggle on behalf of someone else. Today's guest gives us advice to make the process easier, and although it's in the context of caregiving for elderly or medically fragile, these tips will work for anyone advocating on behalf of another in a medical setting. If you're a caregiver, this episode is dedicated to you and definitely for you. If you know a caregiver, please listen and please share it with them. Joining me today is Dr. Monique Nugent, a practicing hospitalist and the Associate Director for the Division of Hospital Medicine at South Shore Hospital in Weymouth, Massachusetts. She's the author of Prescription for Admission, a guide to navigating hospitalization with confidence and ease. With over a decade of clinical and leadership experience, she's dedicated to making healthcare equitable, safe, and accessible for all. As a passionate advocate for caregivers and patients alike, Dr. Nugent offers the knowledge, tools, and confidence to take charge of your healthcare journey. You can find her book in the favorites list on the resources page of the Positively Productive website, positivelyproductive.com/resources. Scroll down for a list of all the books that are mentioned on the podcast. In our discussion today, we cover Dr. Nugent's perspective on hospital stays, how COVID highlighted what needs changing and how people experience things in hospitals, and how it inspired her to help others navigate medical care more efficiently and effectively. The people who have responded most to what she shared are those who are in the trenches, the caregivers. And she shares how her tips for organizing information can also inspire better communication within families too. You'll see connections to past conversations we've had here, like episode 37 with Eileen Moynihan on estate organizing, and episode 221 on helping others deal with trauma and grief with Janice Picashole. Today, we talk about the information you need to have on hand and when and how to update it, as well as how to manage expectations with medical teams. Her advice is both tactical and heartfelt, and it's what I wish I could have heard before heading into appointments with my mom years ago. In addition to the episodes I mentioned, I've also added some caregiver-specific ones in the show notes you may want to check out. And if you need support beyond that, I encourage you to reach out to me. Now let's join my guest to get advice for caregivers to make medical visits easier. Welcome to the Positively Living Podcast, Dr. Monique Nugent. I am so delighted to have you here today.
Thank you so much for having me and letting me share some time and space with your listeners.
I'm excited about this topic. You know, it's a personal thing for me. And before we dig in, I would love to know from you a bit about who you are and what makes you light up.
As you said, my name is Dr. Monique Nugent. I am a practicing hospitalist. So when I say that, I either get people who are really familiar with my job and go, "Oh, yes, I know that." Or people who say, "A hospice? What is a hospice?" And I say, "No, I'm a hospitalist," right? You say it too fast and people mishear you. I'm an adult physician and internist who practices just in the hospital. So I don't have an office. You can't make an appointment to see me. And my specialty is helping people navigate and be cared for in an acute hospital setting. So if you come to the emergency room, you're too sick to leave, but you don't need the ICU and you're not about to deliver a baby, then you are going to see me or my colleagues.
And what lights you up? What do you love to do, whether it's within this realm or something else entirely?
I am inherently a bookish type of person. And recently, I have really dived into my public library's Libby app.
Mm-hmm.
I have little ones, and like I can only listen to Paw Patrol theme song so many times in the car.
Chase is on the case.
I know. And I started using the Libby app to get stories. But then I was like, why am I just using these for the kids? I haven't read a book in forever. And I am loving audiobooks right now. And I know that sounds kind of simple as someone would say, like, why didn't you do that a while ago? But when you're a mom, you don't think that like the thing the kid is doing could be something you could be doing. And I am really just plowing through a ton of books that I didn't even know I was interested in.
Well, all bibliophiles are certainly welcome here. You are you are amongst friends for sure. And I do love audio. I mean, obviously have the podcast here, so I love to listen to podcasts. I love to listen to audiobooks, and it's a great way to kind of like tether your tasks together because you can be walking and doing chores and taking a drive and still be absorbing inspirational information. So that's actually a great tip for everybody. But now let's connect what it is that you do, what you've written with our topic for today that has to do with caregivers specifically. And that was one of the things that jumped out at me in terms of having you on the podcast was that we talk about caregivers. I've been one. It's kind of my origin story for why I talk about what I do, why we have the conversations that we do on the podcast. This can be mamas, this can be those who are caring for someone who's medically fragile or elderly, you name it. That caregiver zone, it's a lot. So I'm curious what the connection is for you personally.
It has always been a personal dream of mine to write a book. And during COVID, when everyone was learning how to do sourdough starters, I was still in the hospital. I was still working. And I think that we had this lionized idea of healthcare workers in the COVID pandemic that was really emergency medicine based. Like people were coming in, they were in the emergency room, and all of this stuff was happening and being reported in the emergency room. And there's a whole group of us upstairs in the rest of the hospital seeing patients for the entirety of their hospital stay. And all the things that were happening in the hospital before were still happening, right? People were still having heart attacks. People still fell down, broke hips. People were still having infections. People were still getting diagnosed with new cancers, right? But now you're navigating those things in the pandemic where we're isolating more and more. And I got this idea. I was like, I'm going to write a book to teach people how to get through this, how to navigate this whole like pandemic thing. And as I was writing it, I found that really it's just the same exact information. It was just kind of souped up. Like the pandemic didn't create any new problems. It showed us the problems that we already had, it amplified them. And the problems around hospital stays for patients and caregivers were the exact same, only worse. Lack of communication, not feeling like they knew what was going on, not being able to get access to resources, not knowing who's who and what's what in a hospital stay. And that's where Prescription for Admission came about. It's a patient facing book saying, like, hey, this is what goes on in a hospital, right? what is NPO and why do you have to be NPO, right? That's like everyone's dreaded, don't get to eat, but what is the safety reason behind it? Trying to give you a little bit more background that maybe you're getting in the hospital. And I naively thought that everyone would be like, oh my goodness, this is amazing. I'm going to buy this book and I'm going to be really informed. And that wasn't the case because talking about being in the hospital is kind of depressing and people don't like that. The people who talk about hospital stays are the people who have put in the work already, who have already had unfortunate situations, who have already felt traumatized by the healthcare system. And a lot of the time, that's caretakers, advocates for people who are medically frail, who are elderly, who are complicated. Those are really the people who picked up on this. And I was like, wow, this is really kind of a need that is there, but you don't realize how hungry people are. And then little by little, information started to get out there, and I would get like random text messages and phone calls like, you don't know me, but such and such says that you could help me figure this out. I read this article by you, and it really helped me to get this together, but I don't know about the next step. And that's really when I started to get more into reaching out to the caregiver community. Because here's the truth that a lot of people don't understand. Most of us will play the caregiver at some point in time. There's millions and millions. I think I saw something that said over 50 million people who are active caretakers in the United States. I'm maybe quoting that number incorrectly, but it's very high. And the caregiver role is one that changes over time. You raise your children and they get more independent. If you're caring for someone who is elderly, it's the opposite. They start needing more and more and more. I'm really coming to understand that elder care and caring for people who need more is crisis based. Something happened, you end up in the hospital, you circle the wagons, and when you leave, life is different. And now you react to and you create this new different until the next crisis. And then they're back in the hospital or they're back in the doctor's office or something. And then, okay, what is the next new reality? And that's tiring. To live between crises is tiring. We have to help people to navigate that.
And I think, and I'm hoping by this kind of conversation to encourage them to think about it in, again, a proactive way versus reactive, which is, the message that I give for so much of what we do in our lives and all of the productivity approaches that we take. But the idea that there are things that are potentially coming down the line. Now, you have to be careful. I know as a caregiver, and I was dealing with Alzheimer's specifically, it was challenging to know what to expect because you can't really, but you can have some general ideas. You can do some research. Support groups were tremendously helpful, but you're right. Most of what I navigated was, well, this happened and now I got to figure this out. Now I need to talk to people. And so I'm hoping that as we see such a growth, I mean, we had the baby boomers, so it's like, well, now we're
Yeah.
caring for them, right? So this is a numbers game. This is
Yeah.
definitely growing. So how do we find ways to handle it efficiently and with heart?
I think the thing that we're really navigating with our parents is not just how do you prepare, how do you emotionally start that process, right? Because there are cases where the adult child has been the caregiver for a while and their parent is quite incapacitated and not able to make decisions for themselves. And it's kind of clear cut. But for others, it's a stepwise process of needing more help and giving a little bit more of their control up. And then that's to you a little bit heavy because it's the person who taught you how to do these things. It's the person who was your resource, who now you are a resource for.
Mm-hmm.
And you want to be respectful and you want them to feel empowered. So you don't want to bulldoze someone and be like, well, now it has to be this way. But it's also sometimes can be frustrating because they may not, to you, make decisions that you think are wise that go along with the way we do things now or what you think would be a better outcome. And that's a hard give and take.
So obviously it's Facebook complicated, right?
Yeah.
There's a lot going on there. There are a lot of emotions and things like that. But would you say, and maybe this is the next segue into you sharing your expertise with us about this, ways that you can kind of come at it from, I guess, a systematized approach, an organized approach? Are there things that we can do? Like, it's hard enough to have the emotional conversations and to navigate that relationship side, but what are some of the things we can do to make it easier on ourselves?
So one of the things that can make it both easier on you and the person, your loved one, your parent, is to get information organized. Like rarely is your parent going to argue with you about getting information organized.
Right.
Right? And that's like easy low hanging fruit, but also helps open up the conversation. What I always say is information is safety when it comes to a hospital stay, right? And any kind of interaction with healthcare. So things like knowing their medications is really key. But how many people are going to remember lisinopril 20 milligrams, HS plus, then I take a metoprolol 25 2 times a day. I take my levothyroxine in the morning on an empty stomach. Like that's for me to know the specifics of all of those things, right? But showing up and saying like, my morning pill, the triangle one, that doesn't help either, right? So it's like, I have no idea what the triangle one is. Having the information, knowing your health information or where to get it, right? And a lot of times your pharmacy has apps, your primary care has apps that can help you organize things. There's nothing wrong with pen and paper in any way, shape, or form. Put it down. And then your parent may also find that easier for them to update when they go to the doctor. Oh, okay, I now am on 40 milligrams of lisinopril, cross out 20, put in 40. So whatever system you create to start organizing information, because information is safety, then that is huge when it comes to a hospital stay. The number one thing I want people to come out of a hospital is safe. It's the same thing with their health, past medical history. Again, your primary care doctor may have an app, but there's nothing wrong with writing it down. Now, I've seen people show up with big binders, and those are often people who may have a lot more of a complicated medical past. Again, nothing wrong with that. Just hand me the key pieces that you think I need, or the ones that I'm specifically asking for that you can easily find. Keep your stuff organized. And that also allows you to have this conversation around healthcare proxies, advance directives. Like, hey, mom, we're getting all this stuff organized so that we have it in the app. I also want to make sure that Dr. Smith is able to scan in your healthcare proxy. Oh, okay. So now we can have this conversation about that. And always try to get as much out of the conversation as you can, right? So, mom, we're getting all this stuff together. I want Dr. Smith to have this healthcare proxy scanned in to his system so everything's organized. I know you said you want Lisa to be your healthcare proxy. Does Lisa know what that means? What exactly do you want Lisa to do if something happens? How can Lisa really advocate for you for what you find are your goals around comfort? Are your goals around your activities? Are your goals around your long-term care? Instead of just like, oh, who's going to be your healthcare proxy? Lisa, thank you, and move on, right? Try and have those conversations to flesh it out because mom, you said Lisa was going to be your healthcare proxy. You've told Lisa what you want. Let's just write it down on this advance directive. And now we have this advance directive done. And see how you can have these conversations naturally lead into each other because these conversations are awkward, right?
Yeah, they can be, and they can be vulnerable, and they can be real. The DNR, the do not resuscitate, that's a big conversation. Like, but you're right; these things do lead to, especially if, and here's the key point that I want to bring out in what you described is the asking questions, and that's our favorite thing here. We talk about it on the podcast all the time. Is the being curious. Is that this is an opportunity where you're like, let me fill out this form correctly. Hey, mom, what do I put here? Wait, now let me understand this correctly. So then it's not a judgment. It's not, an argument. It's not counterpointing something. It's
Yeah.
clarifying.
Yeah. And allowing people to have space for their fears, their wishes is huge because so many times we think like somebody wouldn't want that. I remember teacher of mine when I was in residency, she told a story. Her first job that she took was in a smaller town that had a pretty large elderly population. And she remembered thinking, my goodness, like, how do these people live like this? Like, everyone is so debilitated. Everyone is so slow. I'm having to help everybody up and down. They have all these aches and pains. But then the longer she worked there, she's like, what I started seeing instead was all the things they were doing, all the joy they were having, instead of everything I thought they should be doing.
Hmm.
People's values change over time. People's expectations for themselves change over time. People's expectations out of medicine, people's fears as they experience more things may change. Someone who may have been really gun ho about something, as time goes on and they experience more illness or have more like interactions with healthcare, and they may actually like pull back. And you would say, like, wait a minute, but you used to say this. That's okay. There's no right answer, wrong answer. There's your answer. And that's exactly what I tell people all the time.
And to that point, that makes me think about when we are gathering information, and I love that information is safety. I want to keep repeating that. I think that's such a good takeaway. But as we're gathering this information, as we are organizing, which gives us the opportunity to have the conversations, what would you recommend in terms of how we look to and reflect and update this information? Because I know I've done the DNRs and the healthcare proxies and things like that. And sometimes you do that and yay, you've done it. And this is awesome. And you tuck it away and you forget about it. Now, with medications, I can totally see if you get a new prescription, that's kind of an obvious trigger to say, ooh, I should probably update the list. But what about with the others? What would you recommend?
So usually people have this like natural kind of cadence to their lives where what we might call like particularly in older people or people with dementia, like a stepwise downward process that like they're doing okay, something happens, they get a little bit sicker, now they get a little better, and their new baseline is here. Those instances are a great time to circle back and have those conversations again. There are going to be times where my colleagues like me are looking you in the face and saying, look, we need to readdress this. We need to have a conversation. And if those things are happening and the conversation cannot be avoided, you've kind of set yourself up for it to be a little easier if you've been talking about it anyway. If you and Lisa have been having this conversation because you filled out the healthcare proxy, because you filled out the advance directive, when the doctor sits down and says, hey, look, we need to have this conversation, things have changed, you're a little bit more used to it. So that helps. But if those are the instances that you're having, then clearly you need to have an effective family meeting with the medical team to come out with decisions that are going to dictate care going forward. But if you're not in that space where you have to make a decision right away, what I always encourage people is like after a hospital stay, have what I call a debrief. So in medicine, if we have like a bad outcome, something happens on the floor that we didn't expect to happen, after everything is settled, then we sit down together as a team and we debrief. What happened? How did we get here? What did we do well? What did we do poorly? How are we going to move forward after this? And I want you to bring that same practice into your home with your family. And that is an important time to have that discussion about like readdressing somebody's wishes around their care, their around end of life decisions. But it's also an important time to have financial discussions, because oftentimes there are financial implications to what just happened. Outside of having to pay the insurance copay or the out of pocket maximum of whatever, sometimes there may be like somebody now needs more care. How do we navigate that financially? Do we have to talk to an elder care lawyer? Somebody is going to have to like move into home with their daughter or their son. How do we support that family that's going to make that accommodation? And so doing a debrief, it is not, I think, a normal practice for people. It's clearly something very like institutionalized, but bring that same practice into your family and really unpack that, because that last one How does this change and what are we going to do from here is really key.
I can totally see, and I remember it myself. And I think it's sort of an instinctive thing that I've done. Maybe it's sort of the productivity coach in me, right? But this idea of this sort of what worked, what didn't. And sometimes it's like, oh my gosh, they asked me for this information. I didn't have it on me. And so, okay, next time, what can I do to make it easier, to make it less stressful? What am I missing? What do we need to update? And with that in mind, I am curious if you have a general recommendation when you're headed into the hospital. What should we have on us? You mentioned list of medications. That's a big one. Some kind of medical history, at least to be able to reference. And I'm thinking about when I fill out these forms, I have a tendency to take pictures of the forms that I fill out, and
That's
that can
great.
be a really good reference later, but that can also be something you could use to review and say, this is what they're going to ask me again in the future. And then you mentioned like advanced directives or your healthcare proxies or anything else we're missing or
Something that I always say is like, if you are seeing a specialist, being able to give us that information as to who they are and how we can contact them is also going to be important because the last thing you want is a doctor like me who you've never met before, right? You're on vacation visiting your daughter and all of a sudden you're in the hospital. You don't want me like revamping your whole care plan. You want that us to be able to talk to your doctor and have a conversation that says like this is where they were going. Let's continue on with this plan. How do I help them continue with their care? Instead of creating a whole new plan, right? So if you have a specialist, who they are and how you can contact them. The thing that people don't understand, and I hear it a lot, is like people say, well, it's in my record. There is no nationalized medical record in this country. In these here United States, each medical system has its own decision on how it's going to manage healthcare records, what electronic medical records or health record system it's going to use, and what it does with that information. And so I don't have access all the time. Let us talk. Give us that information on how we can contact that person, how I can get that information. Because again, I don't want to recreate your a plan for you. I want you to be on the road that you and your specialist or your primary care doctor have already set up for you.
and would that be an opportunity for like your doctor to maybe have the conversation while you're in there to say, what's the overarching plan here, the direction you're taking or whatever, like have kind of a summary that maybe you write down in your own notes that you could even express and then say, and here's, her information, his information.
Oh, yeah. And if you have like an overarching goal, our goal is to be able to get mom back in her independent living. And we will work with whatever outside resources we need to do that. Then give us that goal because it's about how realistic that goal is and how we can help you to get there, right? And the reason I use realistic is because I do want people sometimes to understand that stepwise process that maybe things are going to be different. Or maybe things come back to the way they were, but it takes a while to get there. This hospital stay is not going to be the end of your like recuperation story. And so let's make a realistic plan for the next step and the next step and the next step.
Fantastic. I think we have some really good, simple, tactical approaches here. I like that. Is there anything else as we wrap up that you wish I might have asked you about this, or maybe you want to leave us with in terms of inspiration or a specific tip that we should keep in mind?
The number one thing I tell people, both patients and their caretakers, are hospital stays are isolating. Hospital stays can be really chaotic and lonely. And two things I want people to do. One, don't do it alone. If you're hospitalized, don't feel like just because the world is moving on the outside and everyone's still going to work and everyone's still taking the kids to school, that you're being a bother. Let people show up for you in the way that they can and they want to, because you shouldn't be alone. And it's the same thing if you're caring for somebody, being at the bedside all the time, that is heavy. And it doesn't like matter the age that you're caring for someone you love with. That is a lot to always be there. You've got to take a break. You have to let somebody relieve you. You have to let somebody help you and care for you. And the other thing that I want people to think about is put in the work up front. for setting communication expectations with your care team. I know that it is a lot of hours to sit with your loved one in the emergency department until you see the admitting team and have a conversation with them. If you cannot sit there for the time, leave your information, you need to have that conversation early. Hi, I'm Lisa. I am the one helping dad through this hospital stay. I am dad's care partner, point of contact, healthcare proxy, whatever it is your role is. And I want to speak with you after the CT scan is done so we can talk about his plan. I want to speak with you after you meet with the cardiologist. Put in the work early in your hospital stay to set up communication expectations so that you're not flailing. It is hard, but if you can set those goals early and those expectations around communications early in a hospital stay, that may relieve some of your stress. Because if you don't, you're setting yourself up for frustration. You're setting the healthcare team up for failure. Because I guarantee you, it's not on everyone's mind that they have to call a certain person, be it every day, every time things change, whatever it may be.
And when you manage expectations, there can be a point of clarity. Well, if that doesn't work, then what will work? Okay. And now we both know. Now we can make this happen. I love that.
Yeah. And you're talking to the person with the information. Finding out who you need to speak to and letting them know who they need to speak to is really key.
Exactly. Okay. So, yeah, asking for help, don't stay isolated, and manage expectations. Excellent. All right. That feels like a really great place to wrap up. And before we get into the rapid wrap up with a few bonus questions for you, where can we find you online, find your book, connect with you?
So you can find the book anywhere you buy books online. It's entitled Prescription for Admission. Me, you can find on my website is where I like to put everything at drmoniquenugent.com. That's where you can find articles that I've written, my blog that I'm fleshing out. It's going to be a real busy place. I have a lot of big plans for this year. A podcast that's going to be launching pretty soon, online courses that people can purchase and kind of watch and get a lot of the information a little bit more succinctly, and you get to see me. But yeah, please, I want everyone to have this information and improve their experience and advocate for themselves and their loved ones through our healthcare system.
Well, I'll be sure to have that in the show notes as well. So now let's get into this rapid wrap up for things that inspire positively living for you. So let's start with a song, something that's uplifting, that's on your mind right now that you love to play.
So I'm laughing because I'm a child of the 90s.
Mm-hmm.
This is more a 2000s song, but when I am trying to get in my head to like do something, I need to be brave. I repeat to myself the hook of Trina. If you know Trina, Southern Florida rapper, and she had a song called The Baddest Bee.
That's awesome.
And the hook is, I'm the baddest, right? And so like if I need to really like be brave, I'll just get in my head and I'll be like, yeah, I'm the baddest. Okay. The baddest, I'm the baddest. And that pumps me up, and it gives me the bravery to like go ahead and be who I am and be the baddest bee out there.
Love it. Okay. Now, how about a saying? It could be a mantra, a quote, something that you say that you've coined, just something that really, like, again, it could inspire you and pump you up.
Two wrongs don't make one right.
Mm-hmm.
And, you know, it's easy when you're itty bitty and your sisters took your squishy and you're going to take her squishy. It's easy for me to like tell them two wrongs don't make one right. But that is something that has my father said to me and my two brothers over and over and over and over. And as I have grown, as I've gotten older, I lean into that because it tells me that as much as I may feel someone has wronged me, I can purport myself in a way that I will always be proud of. Because in the end, I'm not going to add another wrong to this. And so it has, for me, as I've gotten older, become more and more important in my life to understand that two wrongs don't make one right. It's easy to lash out. It takes a lot more work to be thoughtful and purposeful in how you move on after you feel like you've been wronged. It doesn't mean you give people permission to wrong you, but can you be proud of how you've moved forward after that?
Exactly. Standing in your own integrity is its own gift. Okay, and now how about a resource? Now, you've already mentioned the Libby app, and sometimes I'll say a resource or a book, and you have a book. Is there anything else something that just makes your life easier? Doesn't have to have anything to do with our topic, just simply, this is something you're recommending.
I always go back to this is kind of like simple, but my Fitbit helps me to notice when I'm not paying attention to me.
Yeah.
And what does that look like? That means I haven't moved my body. I have sat in this chair all day doing work for others. All right. I have like not gotten up. I haven't logged my water. And I know it sounds kind of silly because those things are really meant for like people think of them for weight loss, right? But my Fitbit actually helps me pay attention to me.
I love it. It can be used for mindfulness and awareness, and that's fantastic. Okay, and then one little bonus thing is let's share a little gratitude right now. So basically, what or who in your life contributes to positively living for you?
I am married to somehow I found a saint that came down to come live on earth. My husband, Joshua, is a huge support to me in every way possible. He's the reason that was able to write my book. The person who pushed me to say, yes, you can do this. He's always been the person who, in the years that we've been dating and married, helped me reframe myself. Like, you are good enough for that. You are worth that. One of those people that's like, oh, I'm not going to buy that. That's just for myself. He's like, why not? You're worth it. You've worked hard. You're able to do this thing for yourself. And I think as women, particularly women in healthcare, we have this idea that we exist to care for others. We exist as a resource for others, but not for ourselves. And my husband is really good at helping me reframe that, like, if your life vest isn't on, that you're going to drown trying to save other people. And he's my gratitude today.
Oh, I love that. Great. A shout out to Joshua. Actually, I'm laughing because I'm like, he sounds like a man written by a woman.
He's a great guy.
That's awesome. So shout out to him. I love that for you. And you're right. And speaking of gratitude, I am grateful for you. I'm grateful that we connected. I'm grateful for what you do in the
Oh,
healthcare world because I know how difficult it is. And especially that you are trying to connect to the rest of us to help us understand this better and to be able to navigate it better because it's all so very complicated. But if we stick together, it can be so much better. So thank you, Monique, for shining your light so brightly in this world and for sharing that with us today.
and thank you for having me. This was a ton of fun.
Thank you for joining me today. Your time is precious, and I'm honored you chose to spend it with me. If you have feedback or questions, you can find me through the Connect page of the positivelyproductive.com website. And if you're looking for any of the resources mentioned here, from books to products to training and more, go to positivelyproductive.com/resources.